It's no use. It just doesn't want to come out.
Honey, you've been in here for hours.
Oh, I'm sorry for laughing so much. Medical procedures gone terribly wrong, kidney stone fairies, and so many wild medical things we have to talk about. Prepare to laugh and learn a little as we react to Cyanide and Happiness number 5. Let's dive right in.
It's no use. It just doesn't want to come out.
Honey, you've been in here for hours.
Oh, I'm sorry for laughing so much. If you're pushing so hard that you're sweating, you're going to increase the risk of a rectal prolapse, internal or external hemorrhoids. These can cause anal fissures. You need to adjust your diet, high fiber diet, a lot of water. Make sure you're moving around. Make sure that you don't end up in this circumstance.
Maybe a good night's sleep would do you good.
Oh, God. Kidney stones are the worst.
Oh, he's not even talking about poop. He's talking about kidney stones.
Kidney stones.
Kidney stones are horrible. It's an excruciating amount of pain. We give fluids, we give anti-inflammatories, we give pain medication to help relax the tubing so you can get out easily. But they're so painful. Some people are just more apt to get them than others. What do we got here? What's this fairy? Oh gosh. Oh gosh. Oh my gosh. Oh, it's the kidney fairy stone. It's the fairy kidney stone. It's a kidney stone fairy. Amazing. Some are spiky. We call them staghorns. You can give it to the doctor and figure out what the stone is made up of. Majority of it's calcium. It could help in maybe readjusting your diet.
Oh my God, it's
What
worse
happened?
than ever. I think I need to go to the hospital.
I don't know why the fairy put a coin in the urethra. Good anatomy, good picture. Obviously, we're seeing the pelvis, we're seeing the vertebrae, we're seeing arms, and we're seeing a femur, and then just soft tissue relating to the genitals.
Almost there, Mrs. Larison.
Oh my gosh, the doctor again with this mirror on the head. Don't wear those anymore. Oh, we're delivering a baby. Okay.
Oh, there he is.
I love the pop noise. It doesn't make that kind of noise.
There's your little bundle of...
We didn't see the cord getting cut. You potentially will clamp the cord right away, give the baby to the mom, and then you actually wait because then you have the second birth, which is actually just the placenta separating from the uterine wall.
What is it, Doc? What's wrong?
I'm sorry, but your baby, little baby Larry, he's sad.
A screaming baby is a fantastic thing. We want screaming, pissed off kids. That means their airway is good and intact.
You miserable little You're ruining the happiest day of my life!
It's not the baby's fault. The baby's either got poop in its butt, a wet diaper, uncomfortable, hungry, or sometimes there's something called hair tourniquets that you need to look for.
They're usually happy to be alive.
Do you know how long I gave up drinking to grow your stupid in my womb, Larry? 3 months!
Typically, a pregnancy lasts about 10 months or 40 weeks. We shouldn't be drinking. It can cause something called fetal alcohol syndrome. It increases all these other risks during pregnancy.
Let me try, nope.
If a baby comes out and they're not crying, you vigorously rub and clean the baby. You're trying to stimulate the baby to breathe and cry.
Hit him harder! Keep hitting him!
This is all sorts of wrong. We have patients come into the emergency department. We have a suspicion that there's abuse at home. We'll do full skeletal surveys, and then we'll actually get social work involved. Anytime we have a little bit of suspicion there might be something wrong.
This is the worst day of my life! Why couldn't you be normal like that, baby?
Oh my gosh. What? Okay, that was just a very intense, unnecessary, high energy, high stress environment. I bet if they were calm and quiet, the baby would be fine.
Huh, listen to this. It says here that a person is still conscious 15 seconds after their head is cut off.
So maybe this from back in the day when they used guillotines. There are potential movements of the body, even though the head is not attacked, just for a few seconds, but typically the patient's not talking.
Yeah, right. Sounds fake to me.
Oh yeah? How much you want to bet?
I'll bet you $5.
You're on.
Wasn't expecting that. It looks like a humerus on top of his spine, so it doesn't pop off like that. Obviously, it's not that easy to disarticulate your head from your spine.
But modern medicine was able to rebuild him.
Modern medicine? That's now!
Terrible accident. Modern medicine.
Oh my gosh, it's like Universal Soldier. I don't know if anybody's seen that movie. All the doctors, of course, they're wearing their lab coats, their white coats, but they're also wearing those darn mirrors again. Oh my gosh. On head trauma, you can cause a nosebleed. You can have a nasal fracture. Obviously, that's not really going to do much unless you're on a blood thinner. That's going to have you bleed more and more. Holy cow. Even if you're not allergic to these things, it can cause a reaction where you vasodilate enough to where you can die by just not having enough blood pressure. Wow. Falling out of a tree, that's a major trauma, so it needs to go to a trauma center.
Well, you're a little scraped up, but it looks like you're going to be fine.
Yeah, okay. You have all those needles and syringes. We don't know what those are from. We have those containers to put our sharps in, and they're changed out almost every day, especially at the hospital I work at. We know that's a fall greater than 3 times its height and landed on his head. Likely, this would actually take somebody's life.
Looks like you may have
Holy
a fracture
cow.
here. Wait, no, that's just a hair. You're perfect.
Oh my gosh. Imaging for that type of trauma in the United States, we do CT scans, head and neck, and then you'll do a CT, chest, abdomen, pelvis.
Any last words you want to have with her? You should have with her now.
Oh, that's kind of sad.
I'm sorry.
Okay.
This is common, unfortunately, in the emergency department. Family shows up and we'll discuss what's happening. We will tell them the worst case scenario so that way you're kind of mentally prepared.
Who's that?
It's me, your son.
No! I have a daughter! Get out!
Oh, that's so sad. It's so sad because it happens. Sometimes when somebody has dementia, they may not remember who their loved ones are, family members are. It's pretty common to not know, but they know your energy. And I've seen it enough that just being in the presence of your family member in that situation is really important. Oh my gosh, you put on a wig.
Hey, Mom, it's me, your daughter.
Son, you look like a jack.
That was really funny because then she had a lucid interval. It doesn't happen that fast. Somebody doesn't roll over. They basically will just slowly fade, typically.
There. Everything's gonna be all right. So, would you like to go out to dinner sometime?
Oh my gosh. You don't date patients. You don't talk to patients' family members like that. It's a big no-go. It has to do with the fact that you're in a position of authority. It's just not appropriate. Some of the Cyanide and Happiness stuff is actually really good to react to and kind of pull and tease things that we could talk about, which is really important to learn and understand about your body, about medicine, and about how medicine is handled, especially here in the United States. So if you guys enjoyed this, please do me a favor, binge watch this whole series right here. And as always, make sure you subscribe, turn those bell notifications on, hit that like button. It helps the channel grow. Thank you so much for watching and stay healthy, my friends. What am I supposed to do?